Welcome, everybody. My name is David Fuse. Many of you know me. I'm the co-founder and director of nutrition education for Holistic Consulting. And I'd like to welcome Dr. Kim Ross today, who is here to speak with us about amino acid therapy for anxiety, depression, and insomnia. Dr. Ross will introduce herself here in just a few minutes, but she is the CEO for Kim Ross Consulting, the Director of Scientific Communications for Symphony Natural Health, and an adjunct faculty member and senior clinical supervisor for Sonoran University of Health Sciences, which is where we met a few years ago. Just a few housekeeping notes. Everyone's going to remain on mute during this webinar. I'll be the facilitator for questions at the end. You guys can put in your questions to the chat at any time. And this is being recorded, and the slides and recording will be sent out to all registrants following the presentation. So Dr. Ross, many of our attendees were able to hear your psychobiotics talk last month. I was just mentioning to you, and everybody loved that, and we're really excited to hear your presentation tonight. So I'll pass things over to you now.
Wonderful. Thank you, David. Thank you, everybody, for joining me today. I am going to actually hide all of us so I don't see the screen and mistakenly get distracted looking at anybody. So forgive me. So welcome. I'm really delighted to be here. A little bit about myself, as David mentioned, he kind of gave a little bit of an overview, but like all of you, or many of you here anyway, my background is in nutrition and has slowly progressed over the years, really starting with my own personal journey and exploring it through my own health challenges, and that led from one thing to another to another to another. I think I'm done. I feel pretty good at this point that I'll be done with a schooling perspective, but we never stop learning. Again, thank you for being here. We're going to focus in today on amino acid therapy, looking at how you can utilize it as part of your personalized nutrition plans, and really thinking about even just through that lens of if you're not quite ready to jump on this journey, because there can be some more that you're going to want to learn about this topic, at least thinking through that lens of where amino acid therapy could be of benefit and the potential applications for it. So on a general big picture here, you would be able to understand how to incorporate them. And importantly, if it's not quite your space that you want to jump into, certainly being able to collaborate with others in terms of using amino acid therapy. So our journey today, we have a lot, so I'm going to have to really try to stay focused here, but we're going to focus specifically on anxiety, depression, and sleep. So while the amino acids, while we can look at neurotransmitters as a whole, there's a lot to look at. We're really going to tune in mostly to serotonin and GABA and their role here, and talk about some of the considerations for why and how we can use amino acid therapy for these purposes. And I'm going to share with you a couple case examples so you can kind of see it in real world. By all means, I would certainly be doing no favor to not address the fact that depression, anxiety, and sleep are very complex. There are many things that can influence all of these. So we always want to be able to take that step back and look very holistically at a client to say, what's everything going on here? Just because there's depression, anxiety, and or sleep concerns doesn't mean that amino acid therapy is 100% the way to go. Right? We want to, of course, look into their diet and what might be impacting there. Stress is a big one. Aminos can help in helping to manage that, but not to dismiss the fact that if stress is really high, how that plays a role in these three areas. Understanding too, looking at medications, understanding medication interactions, or more importantly, some of the depletions, the nutrient depletions that occur from medications that may contribute to the depression and or anxiety. Some medications, even just timing of them, can interfere with sleep. Of course, really big topic on the microbiome, more than we can get into in this conversation. But as David mentioned, it sounds like some of you participated in the psychobiotics, which is a whole nother avenue to explore here. And then, of course, there's a genetic component. So I'm going to kind of touch on a couple of these as we go along, but I just want to really make sure that to focus in on and remember that this is complex, and we do want to make sure that we're keeping all of these things in check. So one of the things that I found very fascinating when I really started digging into this concept of amino acid therapy is its extensive use. So I found research dating back to 1982 in which L-tryptophan as amino acid was used in combination by itself or in combination with a common drug for using it for depression. And ultimately, yes, the drug improved it, but so did L-tryptophan, and it had the similar results to the drug. So the drug they used was amitriptyline, as you can see here. It was best when used in combination. However, there was improvements as a standalone therapy. So we're going back to 1982 when, I mean, this is a pretty decent size, 115 people were in the study. But yet here we are 2023, almost into 2024, and it's really not a widely used therapy option still. So it's interesting just to kind of see that the history is there. When we're talking about amino acid therapy, we can't lose focus of the fact that really what we're going after here is the focus of neurotransmitters. So I said primarily serotonin and GABA, but I am going to touch on dopamine just a little bit because of its role in this. So as an overview, for some of you, this might be a review. For some of you, depending on where you are in your educational journey, may not have fully jumped into this information. So stick with me if this is just a review for you. But low serotonin can present in many different ways. So we tend to see things like, of course, anxiety being kind of a main or obvious one, but just general lack of joy, general worries and fears. There can be what's called guilt-like depression. And what I mean by that is somebody who kind of basically like could say, you know, I have it all, I have a good life, but I'm still sad. And I don't really know why, or I still have this kind of lack of joy, even though my life is good, but type of sensation or feeling. Low serotonin kicks in when we have seasonal affective disorder. Also, that person who is just really kind of feeling overwhelmed with life and things and the to-do list, they tend to be what we would consider the quote perfectionist. And it's often these types of worries and fears and anxiety that will lead to then the insomnia. And it's typically that person who can't go back to sleep because the brain is going and going and the to-do list. And what about this? And what if this happens? And I'm worried if this doesn't happen and things of that nature. They may also find that they're craving high carbohydrates, especially in the middle of the afternoon. So these are all signs, symptoms that we can look collectively in our nutrition assessment to get a sense of where this may be. So we're not testing for all the neurotransmitters. That's not common practice typically in a nutrition clinic. However, we can look at all of these things and start to pool them together, like what falls into this low serotonin bucket. And if a lot of it is falling here, then we might start really looking down that path. And this really just kind of helps us to take that step back and also just think about how serotonin is synthesized. So serotonin being a calming neurotransmitter, we're going to start with tryptophan. Now, mind you, this depiction here of the synthesis of tryptophan to serotonin and actually melatonin, this is very simplified, but it's the key pieces from a nutritional standpoint. So we have tryptophan that we take in through dietary sources. That this particular amino acid, of course, it has to cross the blood-brain barrier, and it does so with an insulin transport. One of the reasons why this is so important, if we just take a step back and start to piece it out, remembering signs and symptoms, but then also looking at overall from a clinical perspective, if somebody has poor insulin regulation, one of the challenges that we're going to see is they typically are going to have poor transport of amino acids. So it's not necessarily that we need to give them more amino acids. You can actually, in fact, give somebody a bunch of tryptophan, but if insulin transport or insulin dysregulation is not working well, essentially you're still not going to get the tryptophan to the brain where it's needed. So don't forget about all of these cofactors in this process of how our neurotransmitters are actually produced. So let's just assume it's all working well. We have tryptophan coming in, insulin transports it through the blood-brain barrier, and then we have all of these various nutrients that are needed for cofactors to then synthesize tryptophan into 5-HTP, more nutrients to synthesize to serotonin, and then more nutrients to synthesize to melatonin, which is, of course, going to help us with sleep. So as we're going through this, it's not, again, just a matter of tryptophan being the amino acid that we can use, but think about these other cofactors in the process. GABA as a neurotransmitter is also a calming neurotransmitter, but this shows up a little differently. This can be more of that shy, nervous, timid type of person. This is the person who tends to really feel that stress in their stomach, or that knot in the stomach type of sensation. They too can get a racing mind that might disturb them in their sleep. I would say one of the biggest things that I hear is the concept of like an inner trembling, where they just inside, because of that raciness, because of that worry, because of that kind of internalizing knot in the stomach, they feel a little bit of trembling on the inside. So when you're hearing that, you know, you can kind of start to think down this GABA pathway. GABA, a lot's going on for us to get to GABA. There's a lot of places things can go wrong. So again, if we just throw GABA at somebody, that may not be the end all and be all. We want to think through this process here of how we actually even get to GABA. So again, this is a very simplified pathway description here, but I want to start over here at the very left side here with problem number 1. Is that we need glucose, we need ketones, we need free fatty acids to help support the Krebs cycle. But so if we just start here, if again, there's any dysglycemia, one of the challenges is we're going to inhibit this pathway at the very start. So we want to think about glucose control when it comes to the mental health aspect. Neurons are going to make GABA based on glucose control. So really important that we get this section or this portion right when it comes to the dietary aspect before necessarily throwing in the amino acids. The Krebs cycle, as you probably are all well aware, a lot of nutrients going on here, a lot of things that could go wrong here in the Krebs cycle. So think about that. But one of the biggest things here is problem number 2 is there simply enough amino acids in the diet? And if not, we want to focus in on that first. We want to make sure there's enough protein and a lot of variety when it comes to the protein to make sure the amino acids are being consumed. If we go down the process a little bit, we end up with alpha-ketoglutarate, which will produce glutamate, which is excitatory. That is our, get up and go, if you will. We want this balance between glutamate and GABA. It's not all good or bad, but we want to have a little bit of a balance there. So glutamate is going to convert GABA through a GAD enzyme. So here's a little spin into where some genetics will play a role. If somebody has a genetic variant with the GAD enzyme, they were probably going to have a little bit more trouble with the shuttling process, where they're going to end up a little bit more on that excitatory side and a harder time calming down because they're not going to shuttle and transport synthesize to GABA very efficiently. So we think about some SNPs there. We think about some cross-reactivity. Actually, one of the biggest contributors here is gluten, as an example, can actually be one of the cross-reactivity food components that can inhibit this particular pathway. So sometimes, again, it might just be balancing glucose. Let's make sure we're getting proteins. Maybe we need to cut out gluten so the body simply can make GABA properly. Again, here, what you may see a little bit more often is more on that chronic insomnia or anxiety, might be pointing a little bit towards that GAD enzyme. If you're able to check, cool. We don't always have the luxury of having genetic profiles on our clients. I did want to bring up low dopamine from a standpoint of low dopamine is associated with depression. It tends to be more of that irritable depression, people who have really low motivation. In general, dopamine is associated with movement, and when it's low, we move slower. So if somebody's really kind of struggling to go along, they're also sad and they're irritable with it and just don't have a whole lot of get up and go, this could be part of the problem here. One of the things that's important to keep in mind with this too, when we're thinking about low motivation, this also translates clinically into that person who just can't seem to get that program started. They just can't seem to implement your recommendations. They want to, but then they don't. They think they want to, they think they're ready, but then they can't. Part of that could fall into this aspect. So just to touch upon, the various aspects here of where dopamine comes into play. So it's the catecholamine synthesis, and phenylalanine being the main amino acid, excuse me, that's needed here. Now, phenylalanine is converted in the liver to tyrosine, and one of the things I always want to be careful of here when it comes to amino acids, and I'll say this again later, but it's worth repeating, just because amino acids are available in supplement form and we can order them and we can recommend them, doesn't mean we should. They are very, very powerful options. And if we're not careful, we could send somebody potentially in a direction we don't want them to. And this is a really good example of what could go wrong. Phenylalanine, because it's converted to tyrosine, remember, is needed for thyroid function. It will actually upregulate it. And you could potentially put somebody into a hyperthyroid state or potentially even a thyroid storm with tyrosine. So phenylalanine is going to get converted. So these are two amino acids that definitely need a little bit more caution around them. Like tryptophan, we need an insulin transport. Once it gets into the brain, we have all of the various cofactors that are needed not only for dopamine, but then norepinephrine and epinephrine as well. So just remember, big picture here. Again, these are simplified pictures of the overall synthesis, but we've got a lot of things at play. We think about liver function. We think about diet, just in terms of getting enough amino acids in the diet. We think about glucose regulation and then all the various cofactors. So you really don't want to address the mental health without addressing these other things as well. So let's just chat a little bit more about tryptophan as a potential here. So we, of course, have food and supplement sources. When we have higher levels of tryptophan, we do certainly see the lower levels of depression and anxiety-like symptoms. It actually has been shown to be, as I said, back to 1982 in some research, a safe and acceptable treatment for depression, and it can be used in combination with pharmaceuticals if need be. So important to know that this is an option out there, and probably out of the aminos, one of the safest to go with ultimately when depression and anxiety are present. Don't think about just the supplement sources though. I do want to just kind of remember that the food sources are there too. If we work through that synthesis process, remember that tryptophan is going to convert to 5-HTP, which is also an option. Essentially, if you kind of move through that synthesis process, the closer you get to serotonin, the less conversion needs to go on, right? So if you're doing tryptophan, we've got to get it across the blood-brain barrier. We've got to get it to convert into 5-HTP, and then we need 5-HTP to convert to serotonin. So there's a lot of steps going on there. So sometimes get to the root quicker, and 5-HTP can get us there a little bit quicker. It is well absorbed orally. It easily crosses the blood-brain barrier, and I'm sure most of you are familiar with its common use for depression. However, it can be used for other things like insomnia, But one of the challenges in using 5-HTP is that there's no drug nutrient interactions. So you definitely want to do this anyway, but you definitely want to make sure that you have checked for medication and 5-HTP interactions and assess if this can in fact be used. GABA probably is one of my most favorites. GABA is calming. I mean, everybody likes a little calm. If you've ever been at a conference that I'm at, if you find me, there's a chance that I have a bottle of GABA because some speaker, somebody always needs it. It just can help take that little bit of edge off. Interestingly, though, the research has mixed findings, which ultimately shouldn't surprise us too much because that's common in our space. Different doses get used, different forms get used. We're not accounting for different severity, all kinds of things that we have kind of some issues with, if you will, with nutrient research. But right now the findings are pretty mixed. But it looks most helpful for sleep anxiety and also stress response. There are a lot of food options for GABA. And another option too is also L-theanine, which is a precursor. So you can consider both L-theanine or GABA to help with that calming response for sleep and anxiety. Beauty of something like GABA, you don't so much do with, you wouldn't do this so much with tryptophan or 5-HTP, but GABA can be used as needed, as can L-theanine. So like I said, so at the conference, I like to hand them over to somebody who's feeling just a little worked up, and it can just be a one and done for those situational type of concerns. L-theanine also creates, as just an FYI, because I think there's several students here, a calm focus. So really helps from a studying perspective to create where you're feeling calm, but still quite focused to help you with studying, things like that. I think it's interesting because GABA is of pharmaceutical interest, and I hope it doesn't become too much of an interest because I wouldn't want them taking it away from our space in the nutrition world. So phenylalanine is another amino acid. We do have this again as food and supplement, but as I mentioned, it converts to tyrosine, so you want to be careful. You do want to be aware you can use both of them to really help push that dopamine pathway a little bit. The studies are a bit more limited here. And one of the big things is truly there are more contraindications with phenylalanine. So I can tell you clinically, this is not a typical go-to for me. I'm going to kind of work through some of the other neurotransmitters first, really focusing in, remember phenylalanine more from a depression standpoint. I'm going to focus in a little bit more on that tryptophan, 5-HTP, serotonin, and GABA pathways, essentially. Some of the contraindications include high blood pressure, Hashimoto's, any use of SSRIs, the mania, migraines, and then also really being careful overall with any imbalance in thyroid because of the tyrosine connection. Glycine is another amino acid I do just want to bring up because it is also very calming and shows up here really through some of the same pathways with GABA. It is inhibitory, but it is also excitatory. It just depends where in the brain it's being used. And just to clarify, we need a balance there between the two. We don't always want to be in excitatory or inhibitory state. It's really important that they're in balance and working appropriately there. One of the things with glycine, though, is that it can help to improve serotonin levels. And one where it's really seems to be quite impactful is that sudden type of panic that can kick in. So I don't want to call it, true panic disorders or panic attacks, but that person who just really all of a sudden is like, oh my gosh, this is like, woof, I feel really overwhelmed. If somebody wakes during the middle of the night with that type of sensation, glycine can be really helpful to just take that onset of panic away, and if used at nighttime can really help with sleep. In fact, glycine is one of the potentials just to be used for sleep because of its calming effect. So just keep in mind that we have many options. We don't need to throw everything at somebody. Glycine is another one like GABA that can be used as needed. I really like the fact that, well, the glycine I use come in little individual packets as a powder, so you can just mix it in water and go whenever you really need it, and it's easy to kind of just always have handy. As I mentioned, excuse me, the nutrient cofactors are really, really big here. So we don't want to dismiss the fact of what cofactors are needed. Again, if we just throw more amino acids at somebody without the cofactors, without addressing things like glucose control, then essentially we're just throwing more at them, and it's more for the body to process and try to handle. But if we're not giving it the tools to handle it, then it's not going to get utilized properly. So make sure that you're doing your assessments for all the nutrients that are involved in the pathways. These are the big ones that you'll want to be aware of, and make sure that you're supplementing as needed or appropriately, and or making sure that there's plenty of these sources in the diet itself. So also many dietary considerations, as David had mentioned, and we chatted about here already. Psychobiotics are a potential option here to really help with the microbiome. Ultimately, I chose here the Mediterranean diet, the keto, a gluten-free diet. Ultimately, just about every diet out there, and any of the students that I've had have heard me say this over and over, there's pros and cons to every diet. You get really into the research, you're going to find pros and cons to every single dietary pattern out there. So it's really thinking about whole foods. It's thinking about, you know, everything that's needed in terms of the nutrients, making sure there's enough amino acids, aka protein, in the diet, and making sure that glucose control is well maintained. So most dietary patterns out there can do that outside of the standard American diet, right? So utilizing one that somebody can stick to is the most important factor here in helping that. I'm going to do a little bit of a quick shameless plug here, even though it sounds like some of you were on the other webinar that I hosted recently on psychobiotics. Feel free to grab this paper, though. It is an open access on Explorer. Excuse me one second. I became quite fascinated in this space and really dug in, and essentially this paper at the time of writing it was a pretty thorough review of the research that's out there right now, well, at the time, for specifically, again, the focus in on serotonin and GABA when it comes to just the psychobiotics. So really kind of neat to see how just the right bacteria in our gut can have an impact on depression and anxiety as well. So I'm going to share with you in the next couple slides some general suggestions for dosing. I want to just stress again, these are general suggestions. It's really important if you're going to embark on amino acid therapy, just dive a little deeper into it, really understand. One of the biggest things with amino acid therapy is it's meant for short-term use. This is not once you're on it, you stay on it forever. Typically, once you find that right dose for somebody, they're on it for maybe 8 to 12 weeks, and then you would start titrating them off of it. So, and I'm putting that out there because this is one of those things, as supplements that are readily available, people can get caught up in just using it long term. And that's not the goal. The goal is to correct it, to fix the issue, to help support those neurotransmitters, and then when they're functioning well, to taper off of them. So L-tryptophan is going to be best consumed with just a little bit of carbohydrate overall on, an empty stomach. So, kind of go empty stomach and maybe just have a little bit of carbohydrate with it. And you can see here that the dose varies a lot. We're talking 500 to 1,000 milligrams up to 3 times a day. So you could go Start off with 500, see how you do, maybe go up to 1,000 milligrams, see how you do. You might stake it just at bedtime. You might add it in the middle or later in the afternoon to help promote some calm as well. There's a lot of variation here, but ultimately one of the best things to do with amino acid therapy is start low and work up if needed. 5-HTP, also very big ranges here, 50 milligrams to 300 milligrams, also in the mid to later afternoon, as well as bedtime is the best time for this. I can tell you, for as much as I've used 5-HTP in practice, I've never gone to 300 milligrams. So it's quite profound what a little can do. So start lower and only work up if it's needed. The same thing with GABA. GABA is out there in a lot of varying doses, and you can use this at various times as well. Again, start low and work up if needed. So I bolded the 100 milligrams here because that's a starting point where a lot of people are going to feel really good with that. One of the GABAs that I use that I talk about bringing to conferences, it is a one-time 250 milligrams. It's kind of, that's a pretty high stress situation there. There's a lot of wiggle room ultimately with these. So you're also seeing 100 to 500 milligrams, 1 to 3 times a day. So a lot of variation, and we want to be very mindful of it in terms of where somebody may fall with that. GABA, again, is one of those things that you may just use at really high stress times, or if there's a certain time of the day where anxiety kicks in. So let's just say that somebody, it's kind of mid-afternoon because every afternoon they have a meeting with their boss or something like that that creates anxiety. You can use it just then. You can use it, if somebody's tends to be a little bit more stressed out first thing in the morning, the idea of going to work, and maybe they don't need it at all on the weekend, and that's okay. So know that there's some variation in how that even gets utilized. As I had mentioned, you can also just consider starting even lighter than GABA and going with L-theanine. And you could do that in 100 to 200 milligram dosing up to 3 times a day. This does increase really beautifully serotonin, GABA, and dopamine, which really makes it a nice starting point, and a pretty safe, easy option, if you will, to consider if you're especially not sure, well, is it really serotonin I want to impact, or is it GABA, or is it dopamine? This really helps you just kind of, grab it by the bucket there and impact all of them. When it comes to depression, you're seeing a lot of the same things that you did for anxiety. So both L-tryptophan as well as 5-HTP. A couple things here with 5-HTP. This is really good, especially if they're depressed and also craving sweets. 5-HTP is actually, you might see commonly used in some supplement combinations that are used to help with cravings for that reason. As mentioned, it easily crosses the blood-brain barrier and is pretty well absorbed. So it's really good to know, especially if somebody has compromised gut function, that it is going to get absorbed pretty good orally. Again, you have ranges in dose, start low, work your way up if need be. Phenylalanine and tyrosine I'm leaving here and included here, but I just want to really stress with caution because of contraindications, because of the tyrosine thyroid connection. And maybe I'm super in tune to this because my practice, I see a lot of women in particular, and I have a lot of people with impaired thyroid, including Hashimoto's. So tyrosine, phenylalanine are just out for those reasons. So just keep that in mind as you're working through and considering some of those. When it comes to sleep, no surprise, we're seeing some of the same things, right? Where it's the basic pathway here of L-tryptophan to 5-HTP to serotonin to melatonin. So to try to get to the root a little bit more when it comes to sleep, you might want to try, you could really go through all of them, but you might want to try to get to the melatonin source a little quicker. So there's a few ways to approach this. From the L-tryptophan standpoint, if you're going to use it for sleep, use it by 10 p.m. 5-HTP, as I had mentioned, and the dosing that was mentioned earlier for anxiety and depression can be used here. If you want to jump right to the source, then use melatonin. So while that's not technically an amino acid, it is a hormone, but it's a hormone that's made from the amino acid L-tryptophan. Some of you may have heard a lot of a conversation going around with a colleague of mine, Dr. Deanna Minnick, who has been speaking really for about the last year here on the benefits of melatonin with one of her landmark studies that really came out about a year ago now. So really thinking about this one in particular when it comes to sleep and truly the standpoint of what our society has done to sleep for everybody. We're all here right now. We'll call it for what it is. It's dark out. We're all in front of our computers. Some of us might have bright lights on like I do right now. We're being exposed to blue light. You know, we're really disrupting our circadian rhythm just by being present in our world today. Most people, even in their homes, the amount of light that we have on at any given time is really inhibiting melatonin from coming to the forefront. So if you can really focus in when it comes to sleep on some of the sleep hygiene aspects, you may not need the amino acid therapy. You may not need the melatonin. We might just need to promote darkness. So, you know, we're really seeing where there's considered this darkness deficiency, just like you might consider a vitamin D deficiency, is somebody having a deficiency in darkness because they're just exposed to light too much. If you're going to consider the melatonin, low dose, low physiological doses is really what's supported in the literature for sleep. I don't know if any of you caught a webinar that I've done on melatonin for antioxidant and immune support, where there's a lot higher doses that can be used in very specific conditions, things like cancer and different things like that, where high doses are being used because it's being used for the antioxidant effects. But when we're thinking about using melatonin for sleep, it is that very low dose because our body only makes about 0.1 to 0.8 milligrams for sleep. So we don't need these mega doses for sleep. Other options for sleep, you can consider GABA, as I had mentioned, as well as the glycine. Glycine, again, very nice for that person who kind of just wakes up a little panicky, or if it's just the occasional sleep disruption. So it's not an all the time thing where they need melatonin every night or GABA or 5-HTP or anything like that every night, but just every once in a while, those sleep disturbances kick in. So just like anxiety and depression, there's so many reasons why somebody can have insomnia and sleep disturbances. I really think it's important to put on your best detective hat, as I call it, to really get to the root issue. One thing that's, I love asking a lot of questions about sleep. And one thing I've learned over time is definitely don't make any assumptions. If you're all good sleepers and have good sleep habits, don't assume people are doing what you're doing. There are a lot of things I found with one client, and it really just helps to reinforce why asking questions around sleep is important. You know, if there were, excuse me, you know, any kids in the bed, any dogs in the bed? Is it a partner that's disrupting you? What's the temperature like? When have you changed your pillow, your mattress? What's, you know, all these things. You have a TV in the bedroom. And then it finally came to fruition that she says, well, you know, there's this really bright light that comes from my neighbor's house. Excuse me. And I said, well, tell me about that. What's going on? She goes, you know, I think they have like kind of a greenhouse over there. And I go, okay, so what about your blinds? I don't have any. What about your curtains? I don't have any. So my best sleep suggestion at that point was go buy some blackout curtains. And that was the recommendation for sleep. Excuse me. So you definitely want to really try to dive in and understand where somebody's sleep patterns are and what might be happening there before necessarily jumping on the amino acid bandwagon for sleep concerns. Again, from a general nutrition consideration, We can't go about this without thinking about protein intake, protein digestion, glycemic control, iron status, looking at all of our anemias, looking at all of the other nutritional cofactors that are needed for neurotransmitters to be produced. One of the big things would be if multiple neurotransmitters are showing up as being the problem, we want to look for that connecting point. So if you're going through kind of that list of signs and symptoms from serotonin to GABA to dopamine, and it's kind of like, gosh, you know, they fall into every bucket here, then it's probably not the neurotransmitters that are the problem. There's probably something going on in one of these 5 areas. So you'll want to really address it from that perspective. This is a general idea with amino acid therapy, is to go low and then increase as needed. So what you can do is start at the lowest recommended dose, which would be considered your trial dose. And if there's a negative response to that, you're going to cut it in half. If there's a positive response, you just continue until you have resolution. And if there's no response to that, that's when you'll increase the dose. So this really does require some time and careful follow-up to make sure that you're getting it right. One of the things with amino acid therapy is that it's quick acting. It truly is. So if somebody is going to take, let's just say 50 milligrams of 5-HTP, we're going to know that day, did you get a positive, negative, or no response? Give it a few days at that lower dose and make an adjustment accordingly. The way that I actually go through it with somebody, we go through an entire trialing process where we actually open up trial capsules so we can get a really quick response, and I can almost see immediately, say for instance, if somebody takes GABA and they take it just as that either the dissolvable type lozenge or just as the powder, it's going to have a quick response in a calming sensation. So we don't want weeks going between consultation when we make recommendations for aminos. We typically just have a couple days go in between visits. Okay, so I think we're doing horrible on time, so let me move along here. These case reports that I'm going to share with you here, I'm happy to share them with David, and he can pass them along so you could read them in detail. So just to give you a quick overview of a couple cases with this. This is a 26-year-old Caucasian female. She was diagnosed with PTSD, and this is, if you will, a bit more of a severe case. She did have bipolar depression and general anxiety. She was working with a counselor at the time, and she did get a personalized targeted amino acid therapy protocol that was quite extensive, as you see here, as well as some targeted nutrients. Ultimately, just to give you a little bit here in terms of what her recommendations were and the dosings that were used, we do utilize a questionnaire to continually monitor how somebody's feeling. So this is just a sample of it to give you an idea of where some of the symptoms are showing up. This is, again, just a partial to get a sense of where her numbers were. But for instance, you know, at the end of June here and a couple months later, she went from a score of 6 out of 10 down to a 1 out of 10 when it came to negativity. Depression went from 7 to a 1, irritability a 7 to a 2. And so you can kind of just see, I won't read all these off to you, but you can kind of see where these various symptoms are showing up and the improvements that were noted along the way. From her perspective, this was wording, this is the client perspective, that it made a remarkable difference in her life. She had dealt with deep-rooted fatigue, battles of depression and anxiety. Excuse me. She ultimately, at the end here, says that her physical and mental health are stabilizing me, pushing me through stress and other obstacles. I can report, so this is going back a few years, I can report this is still somebody who has managed to keep herself pretty steady when it comes to moods and not having it be impactful of her everyday life, especially with the extreme emotions that she was feeling from the bipolar aspect. Another case study that was done, we actually did a case series. We have 3 different cases in this one. So let me just give you a little bit of a rundown of each of them. The first one was a 65-year-old male. He did have a history of hypertension and joint pain, GERD. He was really coming, though, for increasing stress, anxiety, depression, and insomnia that came mostly from various stresses of life. He and his wife were both caring for aging parents, had deaths of 2 of the parents, some issues with the children type of thing, just life, essentially, that was going on. He was already truly following more of a low carbohydrate diet, so that was just reinforced. But you can see here, even with the GABA, we went from 500 milligrams 3 times a day up to 4, but then down to 2. A lot of variations in where the support can be needed. He did use 1,000 milligrams at bedtime of L-tryptophan and also used 5-HTP, increasing, but then decreasing as well when it wasn't needed. Some cofactors there, he did have a multivitamin. He was already taking a vitamin D, some omega-3s, zinc was added in. And again, you can just see here from a partial questionnaire of where some of the changes were taking place. This is somebody who he had some scores that were high. There was a lot of middle of the road scores, but ultimately a lot overall. There wasn't just one area kind of screaming. There were a lot of different areas screaming. And ultimately, he was being impacted by all of the things that we're talking about today, the anxiety, depression, and sleep concerns. His perspective overall, this is how he put it, was that he had uncontrolled stress that was causing severe fatigue, anger, depression, insomnia, and frustration. It didn't seem like there was a light at the end of the tunnel. After a couple of weeks on amino acid therapy, I felt some improvement in my symptoms, but after 1 month, they were really noticeable. Sleeping better overall, just feeling better. And in 3 months, the results were great, feeling rested, waking up more rested and feeling less stress. As he puts it, it was a game changer for him. So some quick results, but then the extended results over a period of a few months. Another male, 24 years old, with a history of depression, anxiety, migraines. This was a really interesting case because he had a long history of poor academic performance with poor concentration. So, this was dating back into his elementary and high school days. He was given a multivitamin and zinc, basic Mediterranean diet. I'll just kind of go through. Oops. A little too fast there. You can see again some variations in the dosing that were used. I do want to just add, for all of these, the trialing process was completed to figure out the starting dose of where to go. So some of these are starting a little bit higher than you would normally, but that's the dose that the person trialed out at as being effective. You can see some things here, like going from a 5 to a 0, a 9 to a 2, a 10 to a 0 in terms of score. One of my most favorite things about this particular client was the fact that not only did he have resolution, but the big thing was that at the time then of writing this case up, he was back in nursing school, and he was experiencing enough clarity for his mind to actually understand and apply the material. And one of the things, again, just fast forward to today and looking at somebody who is a very talented healthcare provider who was able to not only get through school, but really start to build his career with a clear mind because of amino acid therapy. Oops. Sorry, I went a little too fast there. So we have one last one, and we'll be able to have some time for questions here. Another 23-year-old male. This was one who was diagnosed with ADHD. He was given a prescription, although he decided not to take it, so he sought out nutritional counseling instead. He presented with things like ruminating thoughts, depression, anxiety. He had a gaming addiction, as well as food cravings, very low motivation and energy, and sleep disturbances. Again, you can see his variations here. There was a few additional things that were added in for him. Lithium orotate, I don't know if anybody's looked into this at all, but lithium as a nutritional supplement is very powerful in the mental health space. Dr. Greenblatt and his team at Nutritional Psychiatry do quite a bit of promotion of this and education around how to use lithium from a nutritional perspective. Again, the questionnaire where you can see the progress that was being made over time. This typically, you know, as you're seeing here, this is just a 1-month check-in where essentially scores coming down really nicely and having some normalization of the moods. This is a young gentleman who was able to get relief from his symptoms, but one of the big things here was his relationships in particular. As he said, he's not getting stuck in his worrisome thoughts. His self-esteem and confidence have improved. He did actually move out into his own place and took the initiative to get a better job. So really seeing this through that lens of how people can get stuck in some pretty low and, you know, unfavorable environments, and being able to come out of that and just really feeling quite different in how they show up in their life. So David, I apologize, we're 8 minutes out. I was a little fearful of that, but I'll turn it over to you just so everybody knows. You'll have copies of this. All the references are also included here at the end of the slide for you.
Yeah, thanks so much for an awesome webinar, Dr. Ross. We've all learned so much. We've got some great questions in the chat. Before we do so, I'll give you a quick break from chatting so you can grab a drink, and I'll just highlight that for those of you that don't know, this webinar was sponsored by Holistic Consulting. We provide a premier mentorship program. We aim to turn your passion in holistic nutrition into your full-time career. If you're aiming to earn the BCHN or the CNS credential, struggling with how to create or grow your business or imposter syndrome, then check out the website link there. You can contact me as well. Our curriculum, our weekly live sessions help members prepare for their exam, earn the contact hours, build a business, establish a professional network that they can leverage for referrals and decision-making. So Dr. Ross, the first question I have is actually for me.
Yep.
And I know we did a little bit of this at Sonoran University back when it was Southwest College of Natural Medicine in the business class for those students in their last semester. But most of our audience is made up of students, recent graduates, new professionals in the space of nutrition. What advice do you have for these individuals who are trying to either transition careers and make this, you know, make nutrition their full-time career, or just they're coming right out of college and they're trying to make something of this?
Wow, that's kind of a loaded question. What would be the best thing here? You know, I think one of the things that I wish that I did differently, I guess. A lot of people told me, you know, you really got to find your niche. You really got to figure out what is it that you want to focus in on. And I was like, I want to do it all. I want to help everybody. And I think, you know, for a short period of time that was good, but ultimately really tuning into what gives you passion, what gets you excited, what area of health really are you just that, what are you passionate about? So as an example, early on, because I wanted to do it all, including weight loss, I realized I wasn't really passionate about that. It's a whole different beast, you know, to really take somebody on a weight loss journey. Doing this space in mental health, this is not going to be for everybody. Some people are going to find this very overwhelming. So I think really finding and you know, not comparing yourself to what everybody else is doing out there. What is it that you are passionate about? Where is it that you want to land? And if you don't know, that's okay. You dabble around, that's all part of getting your hours for your credentials as well, and see where that lands. So you can really wake up every day, go to work, and love what you're doing. And I think that's one of the keys in being in this space. The other thing I would say probably overall is I really appreciate David and your team there thinking from a business perspective. Not everybody wants to be in business, and that's okay. He went to school for nutrition. I guess I look at it through that lens too. If you're totally not passionate about business, this is when you team up. There's a lot of clinics out there. There's a lot of people who are looking for nutritionists to be on their team, and you don't have to figure out how to run a business as well. So, know that there's other options out there when it comes to that. So gosh, I could go on and on. There's a lot of things to go on with that one, but I guess that would be my starting point.
That's great, Dr. Ross. I have a few cohort members in our program that are focusing on working with women that are pregnant. Is there any literature or thoughts on the use of amino acids during pregnancy or breastfeeding?
Oh, great question. So that's one space I don't work in. So I can't say that I'm fully up to date and aware of all of the uses there. I would say do a careful consideration. There's a lot of supplements that shouldn't be used during pregnancy and lactation. So the same would hold true here. Right off the top of my head, I'm immediately thinking like probably 5-HTP wouldn't be the way to go. You might do lighter doses, but I would say you'd really have to check that out. And I apologize, I can't speak to it more fully, but it's just I don't work with that population, so I haven't been forced to look into those.
That would be my answer as well. Okay, here's another good one from Corinne. Is L-glutamine, can L-glutamine be a bit too excitatory for some people? And she was asking because you referred to a genetic SNP regarding going down from glutamate to GABA.
Yep. Yes. So we love glutamine for GI stuff, right? In fact, glutamine's in a lot of our GI formulas from a reparative standpoint, and it can be great for that. But glutamine can be excitatory for some. So if you're using it and somebody gets that response where you want to start thinking, because glutamine is going to shuttle it's bidirectional with glutamate. So it's a bidirectional process. So if you're getting too much glutamine and it's getting stuck, if you will, in glutamate and not being able to synthesize to GABA, then yes, that might be indicative of maybe a GAD SNP being there or a GAD variant being there. Also look at gluten cross-reactivity to see if that's where some of that excitatory, so that you're bringing in the glutamate, but it's just getting stuck at, you're bringing in glutamine and it's getting stuck at glutamate and not being able to shuttle over.
Great. So if a client has anxiety and they stop their amino acid therapy and they notice that their symptoms start to get worse, could they go on amino acids indefinitely? Are there any adverse effects that you know of, Dr. Ross?
So one of the things with amino acids is we never just stop them, we titrate. So that's a really important process. So you may have a process in which, you're going to be on them for several months, but it may take you several months to move off of them as well. So you never want to just kind of stop them cold turkey. If you do, I would anticipate that symptoms would come back. If you are going to then, so if symptoms are resuming, can you go back to it? Potentially. This is where we really need to make sure that we're doing our due diligence. What does insulin level and glucose regulation look like? What's happening with the diet? What about these other things that might be contributing? And I think it's really important for me to stress back to the beginning of the program, or the beginning of the webinar here, with remembering the complexity of anxiety and depression. And it's not always about amino acids. Just because we have this as a tool doesn't mean that, it's like if you have a hammer, everything looks like a nail. If we have amino acids, it doesn't mean everything's about it, right? If the anxiety is more of a situational type of thing, if it's a cofactor, is it hormonal? Are there changes happening in somebody's life that way? What's cortisol look like? We don't want to lose sight of all of these other things that can have an influence as well.
When you're working with someone who is prescribed psychiatric medications, do you collaborate with their physician?
Absolutely. There's a lot of instances if they're on psych meds that amino acid therapy is going to be contraindicated. So you might be working with their physician to help them in the weaning process of their meds and introducing amino slowly. I would say from that perspective, in all fairness, this is where more advanced training in amino acid therapy is needed before you try to embark on that.
Great. Yeah, we'll do one more question here. And guys, if your questions weren't addressed, you can feel free to email me at david@holisticconsultinghq.com. Our last question is an interesting one. Can you please elaborate a little bit more about how gluten interacts with GABA production?
Yeah, so it has to actually do with the variant there, and there's some cross reactivity. So I don't know if we fully understand it, right? This is the beauty of the world of genetics that we're really still trying to understand. But it appears that there's a cross reactivity there in which a gluten sensitivity may cause that process to not work as well as it should. Maybe a little bit more apparent in those who have the GAD enzyme variant, but not always. So it can just be a little bit of an inhibitor in that pathway process. So again, there's a lot of reasons for gluten-free diet. I'm not promoting any one diet. I think people should eat gluten too. I think we've become a little too fearful of it, but there's a time and place. You can always do a trial of it and see how somebody feels when you take gluten out. Does the calming come forward for them? And if so, then the answer is actually a gluten-free diet, not amino acid therapy at that point.
Great. Thank you, Dr. Ross. I put my email in the chat for everybody if you want to send your questions that come up tonight, tomorrow, or if we didn't address them, we'll do our best to answer those. So thank you for attending, everybody, and thank you, Dr. Ross, for your time.
Yes, thanks for having me, everybody. Enjoy your night. Take care.